Hi, Premier.
Hi.
We recently heard from Dr. Moore, and it sounded like he was getting ready to recommend that the April 27th date for mask mandates in places like this, hospitals, long-term care, be extended past April 27th. Is that something you're considering? Would you look at doing that?
I wouldn't have any problem at all with that. I really wouldn't. We want to protect the most vulnerable. I've always said that from day one. But I'll wait for Dr. Moore to give us the recommendations like I have right from day one. And if he gives us that recommendations, I'd be more than happy to do that. But most importantly, we have to take care of the most vulnerable. That's why we're giving the fourth doses out. That's why we have the antiviral pills for the most vulnerable and in the capacity. And the hospitals are strong right now. I want to give a shout out to all the healthcare workers. They've been absolute fabulous. They're game changers. If we didn't have the quality of healthcare people in this province throughout this pandemic, we would be in deep trouble. Hearing some positive information about the wastewater test. It kind of peaked and it's slowly going down, but I truly believe everyone should continue to be cautious, move forward cautiously. And we've built up the hospital capacity. We're listening to Dr. Moore's recommendations. But this is an example of building the hospital capacity right here in Scarborough and across the province, adding 8,700 new healthcare workers, adding 3,100 new beds. We're prepared. But thank goodness we're seeing a little bit of a direction going down. Well, first of all, if we had to push the maximum, I'm going to hand it over to my Minister of Health, but if we need to max it right out, we can go as high as, I believe, close to 3,000 if we had to, but we aren't in that position right now. We're actually seeing positive results right now with the wastewater, and let's just hope it goes down, and we're going to be very, very cautious. And that's what we're going to take the approach moving forward, but I'll pass it over to the Minister of Health.
However, with the increase in the number of beds that we've created, the 3,100 beds that we opened up several years ago that remain in operation, with the staff that's been trained and with the rest of the work that's happening, we are sure that we will be able to handle any increases. We saw a huge surge during the third wave. We will be able to handle the numbers both in terms of med-surg beds as well as intensive care beds.
Ahead of Easter long weekend, what's your advice to Ontarians? Should they avoid gatherings? Are you going to be gathering with family yourself?
Well, I'd say stay cautious, right? Stay cautious. If you're having 15 people over, put your mask on, right? Like it doesn't hurt. If you're in a crowded room, just like we've been through this for 2 years now. It's common sense prevails, right? Put a mask on. It doesn't hurt. That's going to be up to each individual person.